Well, happy, beautiful, amazing day. Welcome to this edition of the Dr. Bob Rakowski Podcast. And I have Dr. Martin Rosen here, who's been in clinical practice over 40 years as a pediatric chiropractor. He's a specialist in craniopathy, which, by the way, if you don't know what that is, you might want to know. It can be certainly health enhancing and sometimes profoundly life-saving for some people, right? So, Dr. Martin, you also have started the Peak Potential Institute, which is for everybody. So I want to go into pediatrics. I want to go into cranial. I want to talk a little bit about immunizations. And then I want to talk about peak potential and how you're making the world better. So,
Awesome.
Let's start with this. Well, let's start with the tough one, the vaccinations. To some degree, we want to honor everybody where they are. We want to allow people to make really good choices, but we want them to make informed choices. So how do you help your patients do that on this topic?
So the big thing is that I really think that people have to be educated, understand what a vaccination is. And there's different types of vaccinations. There's live, there's attenuated, and now the new vaccines are MMR vaccines, they're RNA vaccines. So before you make a choice, just like if you take any drug, whether it be an anti-inflammatory, an NSAID, an opiate, whatever you do, you're going to decide what choice or how they're going to affect you, what the side effects can be, what the pros and cons are. And I think that people sometimes jump in too blindly to the vaccination issue or trust too much, even when they see sometimes maybe there's a negative side effect to it, or that if you take a medication and it's not working, you stop taking that medication, or it says it's going to do X, Y, and Z, and it doesn't do that, you tend to go, wow, that medication is not working, or if it has a negative side effect. We tend to do that with all medications. What's happening, I think, and I guess my biggest issue with the vaccine is that the amount of marketing that's done, that, we're, as chiropractors, we're into healthcare, we're into preventative healthcare. And it seems like the medical world is shifting that preventative healthcare is taking more drugs, as opposed to building up the immune system, getting stronger. So I'm all about, and most of the people I know and hang out with are about health choice, being able to make choices that are informed. So putting out information about, well, what does this MMR vaccine do? Why is it different? Why do we keep after getting boosters of it? There's no other vaccine that we get boosters every 3 months. Why is that happening? Or, if my child has already had the measles, or, is chickenpox that a deadly form of a virus, So to weigh the pros and cons, I think now, if I'm not incorrect, which I think I'm correct, there's about 78 vaccines that kids get now, as opposed to what was 8 to 10 vaccines, 20 years ago. So there's been a massive shift. And again, if you're talking about healthcare, maintaining your health, you have to understand that when you put something into your body, it has a reaction, and then it has what people call a side effect, which is not really a side effect. It's another effect that whatever you eat, any drug you have. So you should be able to make those choices and watch it. And as chiropractors and as a lot of healthcare providers, we really feel that health comes within, that strengthening your body, strengthening the immune system allows you to be better adaptive. So if you choose to take vaccines, or if you choose to take maybe some, that's the other thing that should be available to people, that they may not want to take all of them. Like, I'm not afraid of the chicken pox, or I'm not afraid of COVID now. It's been 2 years down the way. The vaccine is the virus itself is much less deadly. We found out there's a lot of people who it doesn't affect actually. So be able to make those choices. And the biggest thing that I find with my patients that I feel bad for them is that they get chastised for making those choices. And some of them even get thrown out of practices if they won't succumb to what their doctor. That would be like if I went to a doctor and I had pain. Years ago, I broke my hip, right? It was a lot painful. And, I had a choice of what kind of pain meds. If the doc said, I want you to take opioids. And I said to him, look, I don't really want to take opioids. I don't really like them. They have a lot of side effects. And he would then throw me out of the practice for that. And that wouldn't be rational. I wouldn't know that doesn't happen. Whereas people may say to the doc, my kid, I vaccinated my kid. Last time I kept the childhood vaccines, and the last time I had a very bad reaction. So I'd like to maybe slow down or back off. They will get thrown out of a practice, and that's not health choice. So what we're about is being able to make health choice.
So here's a practical suggestion. One, find out what's in the shots.
Yep.
Right. And then if you have a question about ingredients like aborted fetal stem cells, you might want to ask about that. There's different detergents. Some have heavy metals like aluminum. Some have formaldehyde. And so one, what's being injected, why? And like you said, the schedule's gone up a whole lot. But I think a good practical question for people would be, if you're going to interview a pediatrician, are you open to having a vaccination discussion?
Right.
And if you have a policy that if you're not vaccinated fully, you can't be in my practice, all right, then you know where that person stands.
Right. And then the last piece is side effects. It's weighing the advantages. Like, so if I don't get this vaccine, what can happen? If I do get this vaccine, what can happen? And then make the parent choices. Like, there are some deadly diseases, right? You don't want a 2-year-old or a 1-year-old getting diphtheria, right? You don't want to do that. So maybe DPT is the way for you, or maybe break it up instead of the DPT, because pertussis is also deadly to kids under 3. But as you get older, it's not as deadly a disease. So just being, it's very frustrating to find out that people can't have a conversation. That's like, if my way or the highway in medicine, I don't think is appropriate. Whether you're a chiropractor, an acupuncturist, a medical doctor, it's like my way or the highway is not an appropriate way to treat people. And I think that's what happens in the vaccine issue.
Well said. Now let's transition to cranial. So tell me about this. I mean, isn't this just a bone that protects my brain? Tell me about this skull thing.
Head 1 and I brought head 2.
Okay.
So right. So is it a solid massive bone? Absolutely not. So one of the reasons you got your head. Oh, you got like your.
Hey, I love cranial as well, my friend. So I absolutely do.
What we teach in Deep Potential Institute is chiropractic cranial adjusting. And I don't need to go into the big differences. Everybody knows about what they call cranial sacral therapy.
No, they don't all know, Doc.
Oh, no,
hang on.
That term, right? But okay. So cranial sacral therapy is an osteopathic way of addressing the cranium, developed by a man named John Upledger, who was a brilliant, brilliant man, not only in what he did, but in his marketing. So most people hear about cranial sacral therapy. Being a craniopath or being trained in chiropractic cranial adjusting is somewhat different as far as the approach. But regardless of the approach, the effect is the same. And so in this little skull, we took a lot of pediatrics. So this is a pediatric skull. You can see there are these soft spots, which we call the fontanelles, and there are these sutures. This cranium is extremely mobile. Matter of fact, in the first year of life, the brain grows 101%. And the whole job of this cranium is to allow the brain to grow correctly. In the second year of life, the brain grows another 15%. So the sutural system, what we call these, cracks in the cranium, is designed to allow the brain to expand. And then when it gets to a certain point, then by the time you're around age 12, you now have an adult cranium, which is sutural system. So it's in those first 2 years of life where the biggest changes are happening internally. Now, for adults and older people also, central nervous system, 80% of your central nervous system is located here. So if there is damage here, distortion here, stress here, you're actually affecting 80% of the nervous system. So as chiropractors, when we adjust the spine and make changes in the spine, we're really only able to access 20% of the central nervous system. And we still know how amazing that is. So often we find people who have certain conditions or issues, or even just general overall health issues, and they've reached a plateau. When you could start to make changes in the cranium, you could actually then affect a larger percentage of the nervous system. And I guess the other thing that I want to point out is when we talk about cranium, adjusting cranium, it's not like when you do with the spine and you see it on YouTube and people twist and crack. And, first of all, we don't do all those techniques. But regardless of the fact, it's not the same. What you're doing when you're adjusting the cranium is there's soft tissue called the dura that attaches inside the cranial bones, attaches over the brain, goes all the way down the spine, and attaches to the tailbone. It's a tube that protects the spinal cord, but inside that tube is a space that allows for what's called cerebral spinal fluid to flow. And cerebral spinal fluid is like a lymphatic system for the central nervous system. So when you adjust the cranium, what you're doing is changing tension in that dural meningeal system. So 3 things are happening. Number 1, you're opening up those spaces for cerebral spinal fluid to move. And that helps to clear out toxins from the central nervous system. It helps to bring nutrients to the central nervous system. It helps control temperature. So it has a vast effect on the central nervous system. The second thing you're doing is changing tension in the dura. And like I said, the dura is a cord that attaches to the tailbone all the way up into infants. It actually comes through these sutures. So it creates tension. So you have those little babies who are very tense. Their arms are always pulled up. They're crying. That is part of that underlying tension. Think about if you had a cord attached from your head to your tailbone that was too tight, it would be uncomfortable. The third thing that happens is every single nerve, as it exits between the vertebrae, attaches to the dura. So when the dura is too tight, it pulls on the nerves and it changes the ability of the nerves to transmit impulses. The best way I explain that is this. If you have a string instrument and you have a fretboard at the top and it's attached, tuning keys on the top and a fretboard on the bottom, When you turn the tuning key, you change the tone of that instrument or the string, and you change its pitch. Well, the same thing happens in the nervous system. A nerve can be pulled too tight or too loose, and that's part of the effect that the dura does. So cranial adjusting has a very much global effect on the entire health of the central nervous system.
Yeah, you explained it from a different angle when you started talking about the purpose of the sutures being for allow the skull to grow, to expand for brain growth. But keep in mind, if that skull weren't pliable, a lot of babies wouldn't get through the birth canal.
You're absolutely 100% right.
Yeah.
That's the whole idea of going down the birth canal. These sutures allow the cranium to mold.
Yep. So my kid, you start looking, and you kids can be born cone heads.
Right.
And what's amazing is nursing is so powerful that usually in just 2 days of nursing, they're going to normalize that. Right.
Well, you're right. Matter of fact, if there isn't a problem, when the head compresses, within 7 to 10 days, it should normalize. If it isn't normalizing in 7 to 10 days, then there's obviously usually an underlying problem that's stopping it.
Would you agree they'll normalize faster? Have you seen hard data that if they nurse, they'll normalize faster?
Well, nursing's always an advantage on so many levels. It allows the baby to use their jaw. It allows them to suck correctly. It helps form the palate. It bonds with the mother. It creates nutrients. I mean, there's a whole list of reasons why nursing is a really very effective and helpful way. And just to back up for 1 second, one of the things that people see and always concerns us is C-section babies tend to have very rounded heads. And people think, oh, they look great. And the problem is, no, they didn't go through the molding. Yeah. The other thing that happens during the C-section, since there is no contractions pushing the baby out, what happens is that the baby is literally yanked out, and that dural system we just talked about gets stretched and can cause a lot of trauma to the base of the neck and the upper cervical spine. So yeah, those are things that happen. But you're right. Nursing is a normal, natural way for the baby to exercise their tongue, allow their palate to expand, and that sucking in and out helps to pump the cranium and helps pump cerebral spinal through the system. So yeah, but that's it. That is a great advantage to be able to do that.
Doc, you just made me think of a story, and it's an old classic story where this individual finds, a cocoon.
Okay.
And I think he found the cocoon after he saw a caterpillar, making it for a few days. And he went to one of his mentors and he said, "This is interesting. What is this?" He says, "Well, that creature that was in there, it's going to become something really fantastic. So in a few days, you're going to see the creature start to break out of that." And he says, "It's going to be very important. It's going to be quite a struggle." He says, "Whatever you do, don't help it. Don't help the butterfly." Right. So what happens is the butterfly is trying to get out. And the boy can't stand it because it's such hard effort. It's painful for him to watch. So he helps the butterfly, and then the butterfly starts flying, and then wings give out and it flies to its death. And so he brings the dead butterfly to the master, and the master says, "You helped him, didn't you?" He says, "How did you know?" He said, "Because the struggle strengthens the butterfly to fly." Now, I have to wonder, that principle seems to spill over to humanity because C-section babies have a bigger challenge, don't they?
I would honestly say, and I did this study probably even 20 years ago now. What I did is I took a list of my new patients, infants who had come in who had the biggest health problems, the most chronic health problems. And what I actually found out is that almost 90% of them, 89 to almost 90% of them were actually C-section babies.
I'm not surprised.
Yeah.
So maybe some bigger study at some point in time. So sometimes you just go back and go, does this make common sense? We were meant to go through a birth canal. Could there be more to it than just it's getting the baby out in the world? And I think there is.
Well, when I was born, or even later, like 10 years later than that, the C-section rate in most of the country was about 6%. Now, in a lot of places, it's close to 40%. And a lot of it is convenience. Parents, that's the other, we talk about education. We talk about a little bit of vaccine. Parents hear the same thing. Doc says, if the baby goes a day over or 2 days over, it's going to be dangerous. It's much safer to do a C-section. I'm like, what? Yeah. That makes sense. We used to wait weeks sometimes
until the baby was ready.
Until the baby was ready. Yeah. Now it's like they think, the doctor thinks the baby has an internal clock and goes, "Oh, my birth date is November 12th. Well, if I don't come out by the 13th, please pull me out." I don't think that's the way it's supposed to be. And people sometimes do it for convenience. Again, It's okay if you do it for convenience as long as you understand the implications of the choices you're making. And I think that's the whole thing when we talk about healthcare, is to understand the implications of the choices that you're making, whether they be pro or con to what you're being introduced to. It's like I was actually talking to a patient the other day about cancer. One of their close friends had cancer, and it's a stage 4 pancreatic cancer. And they want to do a lot of heroic procedures to try and save their life. And his friend told him that he's not going to do that. He's making a choice, like he doesn't want to live that lifestyle. And that's a really big thing when you come face to face with, with your maker, with the time, is to be able to make a choice, an informed choice. Like this guy knows that he has, according to his doctors, they said he has like a 5, maybe 10% chance at best of surviving, the 6 months to a year if he does all this heroic efforts. And he's like, that's not worth it to me. And on a low level, everything we do in healthcare, everything we do in bodies is making a choice. Like, am I going to eat this type of food? Am I going to take this type of supplement? Am I going to exercise? All these things are choices that we should be able to make, but there should be a way that we can be informed without being judged about what that's going to be. And then basically accepting for those choices. But each person should be accepted for their choice. If I choose to live a healthier lifestyle and you choose not to, then that gets to be your choice. But that should be something that is not judged on a regular basis, but people should have the information.
Well, I want to throw a monkey wrench into that concept for a moment, because something that's been proposed for decades is a sinner's tax. Now, you can make the choices you want, but if you smoke, they're suggesting we tax you.
Right.
If your waste is beyond a certain level, they suggest that we tax you. If your cholesterol, if your blood sugar, that gets to be in an iffy range. But
right.
It's fascinating. I agree. As a society, we need to take care of one another. But a healthier society is just that. It's a healthier society. I think we ought to incentivize.
That's where the choice comes in. And I think it becomes a slippery slope if there is an organization or an authoritarian principle that's making that decision. Like if someone from the top says, okay, if you're 30 pounds overweight, you're fine. But if you're 35 pounds overweight, then you get taxed.
Yeah.
That's where the problem is.
It's a challenge. I agree.
Right. So that's where the problem comes in but you're right. We don't want to pay. Most of us don't want to pay for people's, like our healthcare system is shot. It's in a lot of trouble and it's extremely expensive. And every year insurance goes up and up and up because people think insurance companies want to help them. And we're like, no, insurance companies want to make money. They're hoping you don't use the insurance. So when people get really sick, like for example, type 2 diabetes, which is rampant in our society, 99% of the time, type 2 diabetes is preventable. Normal dietary function. So if people start to not choose to make those choices, then it's true, we do pay for that. So I don't have a problem that if we have certain health parameters that are set up, that objective health parameters, and you go get health insurance, and then you're outside of those parameters, that you have a surcharge. It's no different than if you buy a Toyota Corolla and I buy a Ferrari. I'm going to pay a lot more insurance than you are than on your Toyota because I chose to buy a Ferrari. So the opposite works the same way. If I want to take care of my body and be healthier, and if I'm a 60 or 70-year-old person, not on any medication, don't have high blood pressure, I'm not overweight, and fit all those parameters, and you're a 60-year-old person who is severely overweight, has high blood pressure, is already on 3 medications, then yeah, there should be a charge, because just like my car is more vulnerable if it gets scratched, your body is more vulnerable, and therefore it's okay that you pay a little bit more if you want to make that choice.
The world threw you a curveball, me a curveball, everybody a curveball in 2020. What did you do?
What happened to us is, prior to forming Peak Potential Institute, I was teaching for several different organizations, plus for myself. I was teaching outside, hands-on teaching 20 to 28 weekends a year. And when 2020 hit, we had seminars scheduled in Barcelona. We had another one scheduled in Europe, and we had one other scheduled in places they wouldn't let us fly to anymore. We could no longer go to. So we had to cancel the seminars and return a lot of money. But my wife and I were getting, what I did during COVID, what I started doing is I said, well, look, we can't get out and teach, but this is what we do. This is our passion. So I started releasing little videos of my teaching that we had and some of my classes for free. just for people to watch. Here's one on, cranial, base adjusting. Here's one on how to adjust the upper cervical spine. And people started getting good feedback. So my wife and I said, well, why don't we try some online teaching? And we started doing programs. So we had DVDs. We had a whole bunch of DVDs that we had made. So what we did is we took the DVDs and retooled them and videotaped the stuff on DVDs and released them as online classes. And we thought it was going to be really short term. And we said, we'll do this. It's chiropractic. Who wants to go to a chiropractor whose whole education is online? That's a little scary, right? It's like going to a surgeon who's never cut anybody open. But I got really good feedback from the generations below me because, I'm old school. We did everything hands-on. But the 40 and 30-something-year-olds and 40-something-year-olds said, Doc, look, we love the online programs because several things. One, if you notice, I tend to talk fast, so they can slow me down. Two, they said, look, I don't have to close my practice. I don't have to fly. I don't have to rent a hotel room. So I'm now saving $3,000 to take your seminar. I can watch it as many times as I want. I can stop and slow it down. And we still offer some hands-on. And then I can go and practice it because the truth is, even at an online seminar, a hands-on seminar, you get a few minutes or hours of hands-on instruction. Then you go back to your practice and you practice. So this is really the same deal. I get to watch it over and over again and then practice it with my friends and patients. So it made a lot of sense. So it has taken off in the last 3 years. We retooled it. We've done, I have a studio, which I'm sitting in right now, and we do hands-on videos and we release them all the time. We have classes that we release. We have put them together so that the classes drip out anywhere from several weeks to several months. People can take the class. We have Facebook pages that they can go on private. We do live doctor sharing several times a month. We send them workbooks. They get the full transcript. So they get an entire experience when they take one of our classes. And then we also give them what we call to actions because we don't want to call it homeworks because people get, I got homework. But call it. So they have all these things that they get to do to go over the information, to ask questions, to contact with us, and to just watch the protocol. So it's been amazing. We have people right now in our directory from 6 continents.
Well, here's what I want to tell you. What you did is something that many sages have successfully done to pivot during the pandemic to be successful. And I've been trying to create my own personal brand. And my first thing was all things health, happiness, and success.
Oh, yeah.
And when you start looking at success, right? If you never do more than you ever get paid, if you ever do more than you get paid for, you never get paid more than you do. So the idea of adding tons of free value to the world,
right.
Gary Vaynerchuk, I think, built like a $60 million a year wine business by doing free wine, infomercials essentially, right? So you're essentially doing that with Peak Performance.
Right.
And you've taught a number of doctors. So thank you for that, right? We need to elevate the game of everybody that's working with patients out there. But you also have programs for people that are not doctors. Tell me about that.
So we have a couple of programs for people. A lot of people have taken people like lactation consultants or moms. We wrote a book. It's called It's All in the Head. Hold on, let me grab it for a second so you can see, because this is our first book that we wrote for lay people. So this is called It's All in the Head. Of course, it's backwards because I'm mirroring my video, but you can get it online, or from our website. And what it is, it's for parents and other healthcare providers to understand what happens when we're talking about craniofacial distortions, what they can mean by the effect. We talk about the birth process. We talk about milestone development. We talk about primary reflexes. And the whole idea is to give people a window into looking at their child as they're developing in those first couple of years, and to see if there's glitches that should be addressed earlier so that as kids get later on in life, they don't end up with problems. Because what we know is that most kids, whether they're on the spectrum or they have learning disabilities or any problems, it's not till around age 3, 4, and 5 where they actually get diagnosed with the problem. But the issue is that problem most likely occurred earlier and was left unnoticed because no one checked on certain parameters. So when the child got old enough to have to basically push their limits, they were not able to do that because they already had glitches in their system that were creating compensatory patterns. So the whole idea of It's All in the Head in our other classes, we have a class on that book, we have a class on tongue tie, and we have a class on the balance mechanism called the vestibular system that we allow lay people to take. They just don't get the adjustment protocols. And those, again, to help them understand when they're seeing certain things happening either with their children or with themselves, that they know that that's a glitch, that something can be addressed and that can be helped.
Well, beyond absolutely amazing. And so, by the way, there's this wonderful thing called a compound effect. And little things add up. So let's just walk through. If someone has some type of cranial distortion that's disrupting their nervous system,
Right.
And they keep that active in their body for their entire life,
Right.
contrast that to getting that fixed. Every day moving in the right direction towards moving in the wrong direction. Can you think of a few examples to share where people got after it early and noticed huge differences in their child and how they developed?
We see stuff all the time. So one thing that pops into my, well, actually two, right? So here's one. A little girl was brought to us. She came down from New Hampshire, and she had some birth trauma, and she was having what's called myoclonic seizures, which are muscle seizures and spasms. She was having dozens of them a day. And so it was really affecting her development. She couldn't nurse, she couldn't eat because she would literally go into seizures. Any loud noises, anything would give these myoclonic seizures. And she had gotten into some chiropractic care, spinal care. The person who was taking care of her didn't do any cranial work, and they knew about me, so they referred her to our office. So we started doing cranial work, and it is now 7 months into care. And 7 months since she's had a seizure. So she was having dozens of seizures a day, 0 seizures now for the last 7 months. So what has happened is her developmental profile has accelerated hugely, and she's able to start to do things that she wasn't going to be able to do for that particular issue. So we see that all the time. We take care of a lot of kids who've had those kind of issues, kids with learning development issues, behavioral issues. We had one little boy, his mom brought him in, I remember, and he had some behavioral issues. He was always fighting with his brother. He actually bit his teacher. He'd have a really hard time being in a crowd of people. He'd really act out. And mom came in one day about 6 weeks after care, and she goes, "We went to the mall with Henry." I said, and my first thought is, "Yeah, so you went to the mall with Henry. Like, what's the big issue?" She goes, "No, you don't understand. Before we came here, we couldn't bring him into a mall because that much input and that kind of environment, he would go crazy. We'd scream and cry. We'd have to carry him out." He goes, "We were able to bring him to the mall. Oh, and by the way, his brother and him are not fighting, and has yet been any teachers." And so that's a trajectory of his life that he would have been challenged, forever in his life, and it would have been a traumatic experience. And just as we added the cranial work, his entire personality shifted. And I have hundreds and hundreds of stories. I've done I published research papers on different types of non-musculoskeletal parameters that have changed under chiropractic care and cranial work. So they're out there, but thousands and thousands of people have had changes in cranial work. I have patients. A lot of times I'll get referrals from other chiropractors who don't do cranial work because their patient's condition has plateaued, something like migraines. All right. They get somewhat better, but they're still getting the migraines. We start cranial work, migraines start to go away. So when you affect that other 80% of the nervous system, you then give the body the ability to heal, which is what it is, from the inside.
You expand it to the whole being, which it needs to be.
Right.
The simple thing that I teach students and have for over 3 decades is in my practice, anything eyes, ears, nose, or throat is cranial till proven otherwise. But what you've just shown is it's the whole being, right? Because 80% of this central nervous system is controlled right there. Our sponsor is bettercoffeeshop.com, the world's best organic coffee, tested to be free of herbicides, insecticides, fungicides, molds, mycotoxins, microplastics. The cleanest coffee in the world, bettercoffeeshop.com. Sorry to disrupt you on that.
That's great. It's good to learn new things. Yeah, you said something which I really think is interesting, because the other thing about cranial work that people also think, when you said eyes, nose, ears, mouth, TMJ.
Yeah.
TMJ is a global
issue. It's a huge part of the cranial. Yeah.
Right. But it's a global issue. When people have bad TMJ issues, it affects their entire daily living, right? They have chronic pain. They have chronic headaches. They're under stress all the time. Yeah. So absolutely. There's nothing. Honestly, there's nothing that you can do to your body, whether it's stub a toe or cut a finger, that the entire body isn't involved in, that it doesn't have some kind of response to. And that's the thing that, that's the difference between more of a, chiropractic and some of the other holistic healing arts, is that we always see the body as a whole. We try not to compartmentalize it. A patient will come in. I said a little boy come in, his mom said, "Man, he's having a knee problem." and she's been under chiropractic care before. She goes, he's having a knee problem, but I don't know if it's coming from his pelvis or it's coming from his foot. We're trying to find out. And I said, well, bring him in. We'll help him find out. Because, she brought him to orthopedic surgeon, and he went, he just looked at the knee, and he goes, well, there's nothing wrong with his knee. He's got full range of motion, no degeneration, no meniscus. And I'm like, well, okay, there's nothing wrong with the knee, but when he walks, he's, stressing the knee. We did evaluation. So you have to look at the whole picture if you're trying to deal with your health.
Yeah, I'm going to tell one very brief story. I saw Michael Bennett, NFL, all pro defensive end. At one time, he was number 3. He had seen all 32 NFL doctors for turf toe and got nowhere with it. And the answer was simple, because it wasn't, that wasn't the cause. That was a downstream symptom from a core imbalance and a spinal imbalance that chiropractic does so well with. Doc, the time absolutely flew. You are a gift to our planet and a gift to our profession. If people want to reach out to you, how do they do it? And if people want to start studying peak potential, how do they study it from you?
We made life easy for you. All you have to do is go on our website, which is Dr. Martin, Martin, Rosen, ROSEN.com. And from there, you can connect to peak potential. You can connect to all our classes, and you can even go back if you want to my office website on Wellesley Car. So everything is connected into that website. All the classes are on it, everything that we're offering on it, all our information, and the email. If you want to contact us, is exactly the same. It's just drmartinrosen@gmail.com. So we try to make life as easy as possible. Any one of those, any information you want, any questions you have, send us an email, go on the website, check out what we have to see. We'd love to have you there. This is our passion. My wife and I we taught our first seminar before probably most of you were born out there. In 1979 was our first seminar I ever taught, and I've been teaching ever since and practicing since I graduated in 81. So yeah, we're still here. Still fighting the good fight.
Well, you are, and you're winning that good fight, and you're helping so many others. So I'm going to wrap it up with these words. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.
Awesome. Thank you again for having me. I truly appreciate it. It was great talking with you, and I really enjoyed myself.